A very good evening to you and welcome to yet another exciting and educative episode of Family Health. Thank you so much for joining us. But first, as our tradition, let's find out what's coming up on this show.
The baby is finding it difficult to breathe, finding it difficult to feed because it's competing in terms of breathing and feeding.
Playing for him is an issue because he just plays a little the way you know the boys play. He will not have the boyish play.
I was scared at first and tension, but I knew it was the right thing to do.
Once again, much gratitude for joining us. My name is George Oraro. To our first feature, the heart is the most sensitive organ that we have in the body. But at times for some kids, they might be born with some defects in the heart. We met up with a hospital right here in Nairobi who are trying to give a new lease of life to a specific number of kids. Here's the feature that I'm talking about.
1 in every 100 babies is born with a congenital heart defect, which can be life-threatening if left untreated. At MP Shah Hospital, kids with these defects are to get a new lease of life from a series of corrective surgeries.
This initiative of saving the lives of small babies who are undergoing congenital heart defects, and we are trying to help them with, I would say, a fresh new lease of life. And what we are doing in this program today is we have got around 15 babies who are going to benefit from this program.
The surgeries will eliminate lifelong risks of health problems associated with congenital heart diseases.
So all these babies are going to be operated in this new cath lab with the help of all the doctors who are a part of this team. And this entire program will be done free of cost for these babies because the parents of these babies come from very poor background. They can't afford the kind of treatment which we are talking about because the cost of this treatment for each baby is going to be between 500 to 600,000 shillings. So it's quite a big amount for these parents. So what we have thought is we would take it over as a CSR initiative of the hospital in association with this Little Hearts Foundation. And we approached few of our donors and they gladly accepted it, and they have also agreed to donate further.
Congenital heart defect, also known as congenital heart anomaly or congenital heart disease, is a problem in the structure of the heart that is present at birth.
Basically, the medical conditions we are dealing with here are holes in the hearts. The three main ones that we'll be dealing with is one called atrial septal defect or ASD, ventricular septal defect or VSD, and pulmonary stenosis. So some of these patients do not show symptoms very early in life. That's why the diagnosis may delay, but some of them quite early, very young babies already are symptomatic. They present to clinicians and they are picked up by the various tests of the heart done.
Also part of the team is Dr. Salim, who is busy going through the briefs to some of the cases to be handled during this initiative.
So the initiative is very simple. The charity that I've been involved in, this is our second trip only this year already. And the charity has been working for, I think, about 13 years. And they travel to various parts of the world. And what they do is they go with a team of people and try to develop the cardiac services in the country that they visit. So the main countries so far that they've been visiting is India, Malaysia, and I think another one in the Middle East. And Kenya was something that I got involved in because the chairman of the charity had approached me for a trip to India and found out that actually I was Kenyan, so he asked me to lead the first trip, which I did in the Mater Hospital in June. So after the Mater Hospital, we got in touch with MP Shah and we had a discussion, and they were very keen on us visiting and sort of establishing a service here with a new cath lab that they just developed.
Present at the hospital is Brian, accompanied by his mother, who is fortunate enough to have a surgery that would have cost Sarah an estimated 600,000 shillings off her chest through this initiative. She still remembers her first suspicion that all was not well.
Akawa ninapoenda kumpeleka shule, tukitembea kuna kamlima tulikuwa tunapanda kadogo, tukitoka nyumbani, akawa anachoka sana. Kitambo tufike kwa super highway, anahema kana kwamba amepanda mlima Kenya. Sikujua ni shida, kwa hivyo nilikuwa nafikiri ni vile tu tumelea watoto town, tunawatembeza kwa gari kila saa. Nikawa nafikiria ni ulegevu.
Another instance would be when Brian caught a cold and had to make a trip to the doctor's office.
Lakini wakati mmoja nikiwa nimeenda Meru, wakashikwa na homa akiwa na dadake, nikawapeleka hospitalini. Nikaona daktari amekawia kumpima, nikashangaa ni nini shida, na ilikuwa tu homa. Alipokuwa amemaliza, kaniambia anasikia sauti inatoka kwa roho yake ambayo si ya kawaida. Kaniambia hawana mashine za kupima pale. Nikamuuliza kama anaweza nipatia barua niweze kumleta Kenyatta.
To counter this, Brian is to go through a procedure known as cardiac catheterisation.
We access the heart from veins and arteries from the leg, or sometimes very occasionally from the neck, and we use very special equipment to go near the heart and do interventions. If there's a blockage somewhere, if there's a hole somewhere, we close the hole. If there's a connection which is causing problems, we close them. So what used to be done 20-30 years ago with open heart surgery, we now do it via cardiac catheterisation.
In most cases, the reason defects happen are not known, but some connections have been identified, which include women who get rubella during their first trimester of pregnancy have a higher risk of having a baby with a congenital heart defect. The risk may also be higher if the woman has some types of viral infections, is exposed to industrial solvents, takes certain kinds of medications, drinks alcohol or uses cocaine while pregnant, or women who have given birth to a child with a congenital heart defect are at a higher risk of giving birth to another child with a heart defect. Signs and symptoms of congenital heart defects depend on the specific type of problems. Symptoms can vary from none to life-threatening.
Playing for him is an issue because he just plays a little. The way you know the boys play, he will not have the boyish play because he'll play a little, get tired, and then say, sitaki hiyo game, tuchezeni game nyingine. So definitely the way you expect a child to be playful, he's not that playful. And he's also a poor feeder. I don't know whether it is related to that. And when I took him to school, he was not concentrating. He was getting very fatigued, and he would sleep most of the time, which is unusual because at school they have a nap after lunch, and if the child is not in school after lunch, he'll go home, eat food, and then take a nap, wake up later to do the homework or even just relax. But the teacher told me he was sleeping most of the time.
The baby is finding it difficult to breathe, finding it difficult to feed because it's competing in terms of breathing and feeding. They're using a lot of energy to grow, so they are usually quite small. They get a lot of respiratory infections. They fall ill quite frequently. And you just find that they don't have a lot of energy. They get quite tired all the time. And once you close it, they usually go back to normal within a few weeks. They become normal, they grow much faster, they have a lot more energy, they're not breathless anymore. They become like a normal baby.
Due to lack of funds, Brian has been on drugs to control his condition, but is due to get a long-term solution.
He was told to be taking propranolol, which is to control the blood pressure, and it has been quite expensive for me because a dose for 1 month goes for 2,000. Yeah, that's a big budget for me.
Join me in commending what MP Shah Hospital is doing. My only wish is that more hospitals could join hands so as to support some of the needy cases out there. But still on the heart, here are a few interesting things that you should know about. I should be going for my break, but just before that, it is time for Eat Smart. And this particular evening, we are looking at the health benefits of eating a banana. Do have a look.
Bananas are extremely healthy and delicious. They contain several essential nutrients and have benefits for digestion, heart health, and weight loss. Bananas are loaded with fiber, both soluble and insoluble. The soluble fiber has the tendency to slow down digestion and keep one feeling full for a longer time. To kickstart your day, include bananas in your breakfast meal so that you can start about your day without having to worry about the next meal. Apart from the fiber, it is loaded with essential vitamins and minerals such as potassium, calcium, manganese, magnesium, iron, folate, niacin, riboflavin, and B6. These all contribute to the proper functioning of the body and keeping you healthy. The high content of potassium in bananas makes it a superfruit. This mineral is known for its numerous health benefiting properties, including regulating heartbeat, blood pressure, and keeping the brain alert. Are you anemic? If yes, then have a banana. Due to the high iron content, they are good for those suffering from anemia. Aside from being very nutritious, they are also highly convenient snack food.
Now you know why you should be taking bananas on a regular basis. Tell you what, I'm taking a short break, but the more reason why you should stay tuned is afterwards, we show you the corrective procedure to some of the heart defects in kids. See you in a short while. Thank you so much for staying tuned to Family Health and picking right up from where we left. Earlier on, we played a clip on some of the congenital heart defects. Well, still at MP Shah Hospital, we were fortunate enough to have a look at what the corrective procedure looks like. Do have a look.
When a baby is born with a heart defect, the heart is not working properly. This is usually because there is something wrong with the valves or the blood vessels around the heart. The defect can keep blood from flowing normally and can affect heart development. However, this can be corrected through catheterization, but prior to carrying out this procedure, heart defects can be diagnosed through physical examination, including listening to the heart with a stethoscope, conducting a chest X-ray, an electrocardiogram to test the heart rate patterns, and echocardiogram, which takes pictures of the heart using sound waves.
Sure, so we have a little baby here and we've just examined her and we've heard the story from the other doctors and from the mother, and we're going to have a look at her heart with this machine which is called an echocardiography machine. So it uses ultrasound. We will look at the heart and look to see whether the structure and the function of the heart is normal, and if we find an abnormality, whether we can treat it or whether we should make different plans.
There are two kinds of procedures that you can do in the heart. So one is open heart surgery. Open heart surgery means you open the chest and you look at the heart directly, and that's usually done by a cardiac surgeon. Sometimes it involves putting the child into a heart-lung machine so that you stop the heart when you're operating on it, and the heart-lung machine sort of takes over the beating of the heart and supply of the body. And then once the heart has been repaired or whatever intervention has taken place, you allow the heart to take over the circulation by slowing down the circulation from the heart-lung machine before it continues. What we do, what I am trained in, and what I'm training in as well at the moment, is interventional cardiology. So interventional means that you do cardiac catheterization, which means that it's loosely called keyhole surgery.
Cardiac catheterization is done in an operating room that has special X-ray and imaging machines that normal operating rooms don't have. The doctor makes a needle puncture through the skin into a large blood vessel. A small straw-sized tube called a sheath will be inserted into the vessel. The doctor will then gently guide a catheter, which is a long, thin tube, into the vessel through the sheath. A video screen shows the position of the catheter as it is threaded through the major blood vessels and to the heart. Special tools are moved through the catheter into the heart. The doctor uses these tools to correct the defect. The tools and the catheter are then removed afterwards.
And so we've been able to inflate a balloon across that using a wire that's delivered from the leg in the groin here. And we've inflated that several times, and we've made the valve work a lot better, I think. There is a bit of narrowing in the blood vessel wall above the valve, which is resistant to stretching with a balloon. What happens is that it does stretch, but it just contracts back down again because it's stretchy tissue.
So if you're closing a defect, they need to take aspirin for about 6 months. And after that they don't need to take any more medication, but usually after the second day or something they're usually back to the normal self. If you have a child which is less than 3, you can't control them, you can't tell them you can't do this, they just do whatever they want and they're completely fine.
Throughout this procedure, the patient has to be monitored keenly in an observation room.
I involve towards assisting to the physician for operating the machine, what is called a cardiac cath lab, and this machine need to be trained specially. And also I also support when during the operation that I always keep watching is a hemodynamic stability like blood pressure, ECG, saturation, and beside that I also to be supported the subject of related with the procedure that I will give a lot of hard words which they use it, and I will be there keep updating the technology of hard words, all the technical details to use for the doing a diagnostic and intervention procedure.
As with most procedures done on the heart and blood vessels, cardiac catheterization has some risks. Major complications are rare though.
They are really quite rare. These procedures are generally quite safe, but of course there are some issues which can happen, but usually things, if you sort of plan the procedure quite well, usually can alleviate them. So usually things like a bit of bleeding from the access point, which is quite obvious. You can have a damage to the wall of the heart if you're accessing it. You can have, if you're putting a device in, the device can come off. But usually when you plan the procedure really well and you're making sure that you're using the right equipment, you can minimize the risk quite significantly. So in our practice back in the UK, we see a small complication in 1 in every 100 patients that we do, and even that's usually a bit of bleeding around the groin or something like that. But we very rarely have any other complications if we do have any at all.
Being that many children with congenital heart disease experience delays in their development, getting treatment early is recommended.
Sometimes when they delay, they come in bad shape. This probably wasn't so bad. We have one much younger than him, but in a worse of state. So if we had an access of getting light into the interior, the better. But unfortunately, it's not the case by the time they come. For him, actually, he wasn't coming because he had a heart problem. He had gone for some surgery. Then as he was being examined, the mama was picked. So he was sent to us.
On the question of it being a one-time procedure,
sometimes when the valve is very, very tight, you may find yourself going back much later. Same procedure. It's safe. It's doable, and you can repeat it even in future.
According to Dr. Gashara, parents should be on the lookout for warning signs when it comes to congenital heart defects.
We keep saying this word loud. When you see somebody, let me talk more about children because that's where I am, and he was a child at one point who is not able to cope with other children in terms of exercise, then something is not right. We all know children will go out and play a whole day. But if you see a child who goes in, plays a little, comes out to rest, then something may not be right. child who sweats a lot, that should not be the scenario. They sweat, but probably we say this is a sweating type. Baby who is not growing well, like other children, something again may not be well, and those are the children we emphasize that should have a checkup. Especially for now, the mothers with small babies who are breastfeeding, should you find that the baby is not adding weight adequately, it's good to have an evaluation. Something may be wrong and you don't know.
There you have it. At least now you have an idea on what catheterization is all about. That's about it for this particular edition of Family Health. Thank you so much for staying tuned throughout the entire show. But tell you what, we can always keep the conversation going by using the contact information on your screen right about now. And you can also get to watch all our previous shows which are uploaded on our YouTube page, which is Family Media. Tell you what, we'll keep on bringing different medical conditions on this show because the end result is we want to create awareness on different medical conditions. Until next week, make sure you eat right, stay safe, and exercise, exercise, exercise. My name is George Oraro. Until next week, have a good week right ahead of you.